Hello, it's that time of year again, time for open enrollment. As you know, open enrollment is the time period during which we all need to do three things. First, identify the benefit plans we're currently enrolled in. Second, learn about and consider the changes that will be in effect for those plans during the next year. And third, determine what enrollment changes, if any, we would like to make for the coming year. To make things easier for you, if you want your current enrollment elections to carry over to 2011, you don't have to do anything. The only exception to this rule is for our medical and dependent care flexible spending accounts. You have to make an annual election and indicate what amounts you want to save in those accounts during open enrollment. This year's open enrollment period is from Monday, November 8th through Friday, November 19th at 5 p.m. That gives you 12 days to do what you need to do. If you didn't receive open enrollment materials in the mail over the weekend, you should receive them in the next day or two. In addition to what you will receive in the mail, you can find all the details you need, as well as actually enroll or make changes on Webster. Having said that, I want to run through and explain some of the more significant changes we want you to know about. First, you'll see a modest increase of $15 to $20 per month in employee medical premiums. There are two primary factors that call for these increases. First, and the primary factor leading to medical premium increases, is that we are projecting medical and prescription drug claims will increase by 9% next year simply due to medical cost inflation. This trend factor is difficult to predict, but our 9% projection is on the conservative side compared to national averages that are closer to 9.5% or 10%. The second factor leading to medical premium increases is healthcare reform. Due to federal legislation that was enacted earlier this year, we expect that our medical plan costs will increase by more than $150,000 in 2011. While the company will bear the brunt of these increased costs with our 70-30 cost share ratio in place, all of us as individual employees will be impacted as well. Your open enrollment materials will contain information about the medical plan changes going into effect next year due to healthcare reform, including expanded coverage for adult children up to age 26. If you want to add an adult child to your coverage, you must make a new election. Even if your child used to be on the plan and dropped off after losing full-time student status or reaching age 23, he or she will not be added back onto the plan automatically. You must make a new election. Also related to the medical plan, we're changing our pharmacy benefit manager from Caremark to LDI Integrated Pharmacy Services, also known as LDI RX. This change will be effective January 1st. While Caremark has done a pretty good job administering our prescription drug benefits, we believe LDI is better positioned to service the needs of a company and workforce our size. With no changes in copays or deductibles, the transition to LDI should be pretty seamless. Having said that, there is one new prescription drug benefit that you may be able to take advantage of. That is the addition of a Retail 90 program, which will allow people with 90-day prescriptions for maintenance drugs to choose between mail order service or going to designated retail pharmacies and paying the same mail order copays. You will be receiving more information about LDI and this Retail 90 program in the near future. And you will receive a new prescription drug card in late November or early December that you will need to begin using in January. As for our other insurance plans, there will be no premium increases for 2011. In fact, you will see slight decreases in dental and vision premiums for next year. Now, don't forget to enroll in or add to your medical flexible spending account for 2011. These accounts allow you to contribute up to $3,000 per year and use those dollars to pay for the out-of-pocket health care expenses you incur from January 1st, 2011 through March 15th, 2012. The amount you choose to contribute is spread out over each paycheck during 2011 and is tax-free. Now, there are two flexible spending account changes to note for 2011. The bad news first. Due to federal health care reform, over-the-counter drugs and medications are no longer eligible for reimbursement under flexible spending accounts. Now for the opportunity. Debit cards will be available for use in 2011. For the cost of $1.50 per month, which will be deducted from your paycheck, you can request a debit card loaded with your annual election amount and use it to pay for office visit and prescription drug copays instead of having to pay out of your pocket and then file a paper claim for reimbursement. Refer to your open enrollment materials to learn more, including how to request a debit card. That's it for now. As always, we continue to ask for your partnership in managing healthcare costs by encouraging you to take charge of your healthcare decisions and spending. With additional healthcare reform measures on the horizon, our costs will continue to increase, so we need to work together to manage them the best we can. One last reminder, Open enrollment ends at 5 p.m. on November 19th. Don't miss it.